BioTE is a company that was started to help physicians learn how to do bioidentical hormone replacement therapy using subcutaneous hormone pellets. If you use pills, your hormone levels are going up and down like a roller coaster ride. Number one. Number two, they have increased risk for blood clots, heart attacks, stroke, and breast cancer. You don't have that with subcutaneous hormone pellet therapy. With patches, you have the same problems in terms of increased risk for breast cancer and the roller coaster ride. With pellets, you maintain constant blood levels. They stay that way for 4 to 5 months, so you only have to do it for a couple of times a year. The real problem in bioidentical hormone replacement therapy is people don't know how to interpret lab work because they only know what the lab says, and the labs are very confusing. So a great portion of the didactic portion is taught teaching physicians and other people in their office, their PAs, their nurse practitioners, how to interpret the lab work so that they can balance people's hormones. It's not about just giving hormones, it's about balancing people's hormones. That's what we do at BioTE. BioTE is about interpretation of lab work. Moreover, we have a proprietary dosing site that has 30 years of experience. So all they have to do is put the lab work in to the computer and they get exactly how to dose the patient, whether they need estrogen or in males testosterone or in females who need both estrogen and testosterone. There's no guesswork. It's very reproducible, and if that patient were to go from state to state, they'd get the exact same dose. That way we're able to lower the side effect profile that people get from using hormone replacement therapy because they don't dose it appropriately. We also provide the product because we have very high quality subcutaneous pellets that are checked both independently and by the compounding pharmacy. After we train them, we give them the pellets, we give them the trocars, and we teach them at the same time as training how to put them in. So they have both didactic and experience with patients. We also train their office staff. So their office staff knows how to market. They know how to answer the questions. So that way they can intelligently talk to the patients before they come in. So it's a turnkey operation. They get everything and they don't have a capital outlay to have to buy equipment and pellets and everything else.
We have an entire training system that we not only train you the science on how to exactly dose our patients, but then we also want to teach you and train you on how to implement the business side of pellet therapy into your practice. And so we have and assign physician liaisons that come in that have a complete business practice and a complete business program that train you and your staff how to implement the pellet business into your practice. That would be from advertising and marketing and seminars. We provide all of your brochures, we provide all of your marketing pieces. So it's really a turnkey opportunity from a standpoint of helping you add an additional income stream and allow you to become a specialist in something that you may not have studied in the past. So it really is a unique opportunity from that standpoint. As far as income is concerned, our guarantee is to get you to doing 100 procedures per month. When you're doing that, the way that our revenue stream works with you on that, that's a net of about $250,000 to your bottom line in year one. And something that's unique about it is the fact that it's somewhat of an annuity. When people get on this therapy, we have a 95% retention rate. So when they get on this therapy, they come back and they come back and they come back. Why? Because it works, right? Number one. And then when they're seeing such a change in their lives, they are able to bring in a lot more referrals, and they bring a lot of referrals to your office that you would not have ever seen. So not only does it help you build your practice as far as the hormones are concerned, but perhaps you're doing other services. You may be an OB-GYN, or you may be a family practice doctor, and those people that come in specifically looking for hormone therapy then become patients for you in some of your other endeavors.
If you want to know more information about BioTE Medical, go to biotemedical.com. That's BIOTE medical.com. All the information is there. Then you can send us an email. One of our liaisons will contact you, and we'll be able to give you all the information on how you can become a provider for BioTE Medical.